Hi, everybody. Hard to believe it's been 2 months since we announced the evidence-based hair training program. We're now 3 months away from the start of the program and 2 months away from the December 1st, 2023 deadline to receive applications. We're really excited about this program. We've received many applications so far. It's an 87-week program running from January 2024 to August 2025. A program which is both intense and rigorous, but also a lot of fun. Participants meet on Wednesdays or Thursdays for 3 hours, depending on the date that they choose. We work on a number of scenarios in hair loss with particular focus on problem solving. Long written questions, short written questions, multiple choice questions, a lot of case-based scenarios, as well as lectures, really round out a comprehensive program in the diagnosis and treatment of hair loss. It was 2017 that I embarked on a goal to create a comprehensive program for hair loss. Prior to that, we had week-long training programs in hair loss, which were great programs, quite intense, a lot of fun. But I wanted to create a program which allowed us to dive in even deeper than what I was able to offer through those week-long programs. Spoke a lot with medical educators involved in the education of the adult learner, as well as hair loss specialists in various realms, to come up with a program which serves the needs of a variety of different hair loss practitioners. And through that, we're really happy to be able to announce the Evidence-Based Hair Fellowship Training Program. You see, one of the problems in how hair loss is taught in the present day is that we follow a very familiar pattern of learning information, which presents difficulties when we're in clinic trying to deal with some tough cases in front of us. When we learn about hair loss, we learn factual information and we store that in the brain. What is the epidemiology of the disease? How does it present? What is the pathology? And what is a list of 4, 5, or 6 different treatments? And after putting all that information in the brain, we feel very satisfied. But when it comes to the clinical scenario, we are not presented with a patient in room 4 who has the information you learned in chapter 3. Rather, we have a patient in the room who has a red, itchy scalp. And so do we draw information from chapter 2 or chapter 8, chapter 5, chapter 12? Is this scarring alopecia? Is this seborrheic dermatitis? Is this allergic contact dermatitis? And so to be able to develop skills in problem solving is really what leads to a well-rounded hair loss practitioner. And so we embarked on the creation of a program which allows for the acquisition of those skills slowly, methodically, bit by bit, through taking on questions, taking on written answers and multiple choice questions, making mistakes, refining those further, and emerging with a significant amount of skills. It's scary to see patients with hair loss when you're starting out. In the textbooks, you're presented with a patient with a patch of hair loss, the perimeter of which has exclamation mark hairs. And when you read that scenario, you feel very comfortable that this is alopecia areata. In contrast, when you go into the clinic, you have a 52-year-old patient who had hair loss since age 12, but it always grew back. And then at age 42, hair loss developed again, which didn't grow back. It started after the patient went away to visit family overseas and had a yellow fever vaccine as well as anti-malarial pills. And when they returned, they developed progressive hair loss at the back of the scalp as well as the left eyebrow. It's not too itchy, but it's a little bit itchy in the summertime. There is some itching on the arm, and there's hair loss on the arm as well. The patient is fairly healthy. They tell you that they have some problems with blood pressure and depression, and they do take some tablets. They're not sure what the tablets are. You'll have to contact the physician. They're pretty healthy, but there's something with the blood work, something with the liver that's been wrong. The kidney isn't working like it used to. They take berberine and ashwagandha. They used to take oral contraceptives, but now they're menopausal and they take hormone replacement therapy. Used to take testosterone, but didn't feel well on testosterone, so now it's just estrogen and progesterone. And they want to know if you should do a biopsy and if stem cell treatments is indicated. And so these are typical day-to-days. These are what the hair clinic is all about. These different scenarios that present to us. And so the Evidence-Based Hair Fellowship Training Program allows us to take on these challenging scenarios, these very realistic scenarios, and to feel comfortable handling them, to feel comfortable taking information, mixing it in the pot, and saying, we can manage this information. We can know what to do with this information. And it takes time to develop those skills, and I'm very much looking forward to working with participants to develop those skills. I want to thank everyone for their applications. We've received a number of fantastic applications so far. Applications from physicians who are already seeing patients with hair loss, but really want to develop their skills even further and take on the challenges of being their local hair loss experts. Applications from individuals who are in areas of medicine outside of dermatology and want to develop skills in the management of hair loss to be able to help patients. We've received applications from trainees, dermatology residents, and fellows who see themselves as future hair loss experts in their communities. We've received applications from nurse practitioners and trichologists and physician assistants. And we're really excited to work with all these different groups of practitioners at different levels of training to push their skills forward, and for those who want to dive deep, to have available a large number of resources so that if people wish, they can develop a lot of skills in the diagnosis and treatment of hair loss. It's a lot of fun to learn about hair loss. It's a lot of fun to learn about the diagnosis, and it's a lot of fun to learn about the treatment. I want to share with you a really important secret. It's something that you might not have thought of before, and it's something that I believe strongly in, and it's an important basis of the evidence-based hair training program. Learning about diagnosis is a lot of fun. Learning about trichology and trichoscopy is a lot of fun. What do hairs look like up close? What is miniaturization about? What is exclamation mark hairs about? What are yellow dots? What are black dots? The diagnosis of hair loss is absolutely fascinating. When you see people at conferences, people run off to lectures about diagnosis. The diagnosis of scarring alopecia, the diagnosis of hair loss in women. These are a lot of fun. The learning curve is not very steep. You emerge from that feeling like you've got some great skills. The point I'd like to make is that what changes people's lives is not the diagnosis. What changes people's lives is the treatment. What gets children back to school, what gets adults waking up in the morning and feeling like they're ready to take on the day and not focus on their hair loss. What allows people to do the things in their life that they want to do is the treatment that you administer. It's absolutely correct that the diagnosis is important because you need the diagnosis to determine what treatment. But it doesn't stop at the diagnosis. And so much of modern hair loss education stops at the diagnosis. It's a lot of fun to learn about diagnosis, but it's the treatment you connect the patient with that changes their life. And so the secret of helping people with complex hair loss conditions is being confident in the diagnosis, yes, but understanding the array of evidence-based treatments that are available. What do you do when a patient presents to clinic having been on treatment 1, treatment 2, treatment 3, treatment 4, treatment 5? Do you turn them away, saying there's no options? Or do you present them options that you've learned that are evidence-based, that allow them to retain hope, because you know there are possibilities that these treatments can dramatically affect the hair growth potential? And so we'll spend a lot of time in diagnosis, but we'll spend a lot of time in treatment as well. And I look forward to working with participants in these particular areas. Hair loss is really a lot of fun, and learning about hair loss is very stimulating, and it's fun to work with participants with whole different backgrounds. There's a large number of skills that each person brings to the course. We look forward to working as a group together, the Wednesday group and the Thursday group, to emerge in August 2025 as practitioners which are ready to help people around the world with hair loss conditions of diverse types. So December the 1st is the deadline. If you have questions, please contact our team at info@donovanhairacademy.com. There are some webinars, question and answer webinars available still in October and November. I think we've completed 4 question and answer webinars so far in the month of September, and they've been great. 2 more to go. But of course, should you have any questions, just contact our team. I look forward to receiving your applications. I look forward to seeing you in January 2024. Thanks so much for your applications. Thanks so much for your interest. I'm really excited about this program. It's a program that I've thought about a lot since 2017 and changed it many times and postponed our start many times so that I could be sure we have a program that really meets the needs of diverse backgrounds, and a program which is really rich in its educational material, from scarring alopecia to non-scarring alopecia, to hair loss in children, to hair loss in pregnancy, to hair loss in individuals of older age, to dealing with infections and inflammatory conditions, to hair shaft disorders. A really broad-based program which allows us to take on any scenario which emerges in the clinic. Thanks so much for watching this video today. I look forward to seeing you in January for the start of the Evidence-Based Hair Fellowship Training Program. Bye for now.